Good afternoon, everybody. It is once again Ted the Speed Learner, and we are going to be talking about the health care bill. This is part number 59. We are on page number 56. In the last video, I covered these two paragraphs right here, and we will cover some more later on, but right now we're going to cover this paragraph right here. And it says, include within health insurance plan networks these essential community providers where available that serve predominantly low-income, medically underserved individuals, such as healthcare providers defined in Section 340BA4 of the Public Health Services Act. Now, where is this 340BA4? I found it for you. Okay. So if you go to the Public Health Service Act and you look up 340B, you will find this. The covered entity defined. In this section, the term covered entity means an entity that meets the requirements described in paragraph 5 and is one of the following. A federally qualified health center as defined in section 1905(1)(2)B of the Social Security Act. If you want to look that up for yourself, you are more than welcome to. An entity receiving a grant under Section 340A. Okay, so we're in 340B. If you went over to 340A, you would find these entities receiving a grant. Okay, now going down here, a family planning project receiving a grant or contract under Section 1001. You can look up Section 1001 for yourself. An entity receiving a grant under Subpart 2 of Part C of Title 26 relating to categorical grants for outpatient early intervention services for HIV disease. A state-operated AIDS drug purchasing assistance program receiving financial assistance under Title 26. A black lung clinic receiving funds under Section 427A of the Black Lung Benefits Act. I didn't even know there was a Black Lung Benefits Act, but you can look that up for yourself if you want to, and leave a comment down here below. A comprehensive hemophilia diagnostic treatment center receiving a grant under Section 501A2 of the Social Security Act. You can look this up for yourself. A Native Hawaiian Health Center receiving funds under the Native Hawaiian Health Center Act of 1988. You can look that one up for yourself. This just gets better and better. An urban Indian organization receiving funds that under Title V of the Indian Health Care Improvement Act. You can look that up for yourself. Any entity receiving assistance under Title 26 other than a state or unit of local government or an entity described in subparagraph D, but only if the entity is certified by the Secretary pursuant to paragraph 7. An entity receiving funds under Section 318 relating to treatment of sexually transmitted diseases or Section 317J2 relating to treatment of tuberculosis through a state or unit of local government, but only if the entity is certified by the Secretary pursuant to paragraph 7. A subsection D, hospital as defined in Section 1886D1B of the Social Security Act, you can look this up for yourself, that is owned or operated by a unit of state or local government is a public or private nonprofit corporation which is formally granted governmental powers by a unit of state or local government, or is private nonprofit hospital which has a contract with a state or local government to provide health care services to low-income individuals who are not entitled to benefits under Title 28 of the Social Security Act or eligible for assistance under the state plan under this title. For the most recent cost reporting period that ended before the calendar quarter involved had a disproportionate share adjustment percentage as determined under... Oh boy, it just keeps going on and on and on. Okay, so we got that one. This particular one says, does not obtain covered outpatient drugs through a group purchasing organization or other group purchasing arrangement. A children's hospital excluded from the Medicare prospective payment system pursuant to Section 1886 and yada 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 of the Social Security Act, or a freestanding cancer hospital excluded from the Medicare prospective payment system pursuant of da 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 da. Okay, wow. An entity that is a critical access hospital determined under Section 1820 of the Social Security Act, an entity that is a rural referral center as defined in Section 1886 da 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 Social Security Act, or a sole community hospital as defined da 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 da, and that both meet the requirements of subparagraph L1 and has a disproportionate share adjustment of percentage equal to or greater than 8%. Wow. And if you want to go through each and every one of these individually, you are more than welcome to do so. You can leave a question or comment down here below, and we'll go through them individually. But right now, you found it. There you go. Now, all right. Now that we've defined Section 340BA4 of the Public Health Service Act, now we have to define and providers described in Section 1927C1D1V of the Social Security Act. Where in the thunder is this? Again, I found it for you. All right. These entities are described in Section 501c3 of the Internal Revenue Code of 1986 and exempt from tax under Section 501a of such act, or is state-owned or operated, and would be a covered entity described in Section 340BA4 of the Public Health Services Act, insofar as the entity described in such section provides the same type of services to the same type of population as a covered entity described in such section providers, but does not receive funding under a provision or of law referred to in such section. Whew. That's a lot of words, people. Okay. Okay, and this is all set forth by Section 221 of the Public Law 111-8, except that nothing in this subparagraph should be construed to require any health plan to provide coverage for any specific medical procedure. Okay. So what these things are saying is that all these programs that I described are for low-income people, and these health insurance people have to cover all that now. I don't know why, but they do. Okay. Now they have to be accredited to respect to local performance on clinical quality measures such as healthcare effectiveness data and information set, patient experience ratings on a standardized consumer assessment of healthcare providers and systems survey, as well as consumer access, utilization management, quality assurance, provider credentialing, complaints and appeals network adequacy and access, and patient information programs by any entity recognized by the Secretary for the accreditation of health insurance issues or plans, so long as any such entity has transparent and rigorous methodological and soaring criteria. Wow. Now, if that isn't a bunch of hoopla, I don't know what is. But if you guys want to comment on this, you are more than welcome to. Leave a comment down below. I'm going to stop the video right here because this thing is just getting longer and longer. We are still on page number 56. Yeah, you can tell this is going to take a long time. All right. I will tell you more in a future video, so stay tuned.